Louise.
Hello.
And we'd like to welcome you to our Natural Remedies weekend series, and this is part 2. This one is going to be on wound care with burns, sunburns, and skin irritations. And so Louise is going to be taking us through and showing us some precautions and a variety of things, and a lot of things she's going to demonstrate for us today, what we can do to keep our skin and healthy. So we always like to start with a word of prayer and just ask God, our Creator, to be with us for wisdom. So let's just take a moment, please. Father in heaven, we just appreciate your majesty so much, and we thank you for your garden of information that you've given us, your natural remedies. We just ask that you be with us, each one of us in this room today, that you will open our minds, that we can understand and retain the information and learn to apply it so that we can be healthier and happier. Thank you in Jesus' name.
Amen.
So, Louise, take it away.
Thank you,
We're going to make sure everybody has a handout.
Okay.
For notes, does everybody have a...
Thank you so much, Trish. And I would just like to say, make sure that you remember to do your sign-in. Good afternoon, ladies and gentlemen. And I am so excited that each one of you came here to hear this information. And I pray for those individuals who are on their way.
Yes.
We had a very good demonstration last night and learned a wealth of information. And I always believe that the more you know is what's important. So again, my name is Louise Harvey, and I am a CHAT leader. And CHAT stands for Community Health Activist. So, trainer. So it is my responsibility to take everything that is imparted, knowledge that is imparted to me, and to spread it out and impart it to others. As we get started here, if you notice on your handout, some of it I will be following rather closely. Others, I may start talking and you'll think, well, that's not on the paper. And that's intended that way. So I have additional information. If you would like to take notes on your paper, that's wonderful. As a quick reference point, and just because I think that when we're small children, that we learn how to put all of our stuff that we get in school on the refrigerator, okay? And I think that we can still use that in later times when we get older. So you can take it home, put it on your refrigerator, quick reference point, right? So the first thing I want to say, as you notice on your sheets, my disclaimer is that none of the natural remedies, none of them, discussed in this seminar is intended to diagnose, okay, treat or replace any medication, current treatment by any healthcare professional. Please remember to contact your family physician before starting any sort of treatment of a natural nature. Natural means as some remedies may interfere with current medications. Case in point, if you are on a blood thinner, you probably don't want to eat a lot of garlic because garlic is a natural blood thinner. There are other heart medications that we get on, and some of the natural things such as onion, garlic, some herbs, parsley. These could possibly interfere with that medication. So this is not intended to replace anything. And if you notice any sort of reactions to any of this, you should cease immediately and discontinue and seek medical treatment. What I would always suggest is that anything that you're getting ready to, anything that you're mixing up naturally, do a test first to see if you're going to have some sort of reaction. Like some people are allergic to avocados, which is one of the ingredients that we are going to be using today. Other people are allergic to bananas. So again, this is a very picked up a little hitchhiker there. Run me free. This area right here in the arm by the elbow is a very good spot to do any sort of testing. If you start to notice reactions, reddening, bumping, anything like that, wash it off immediately, apply a cold compress, and watch it, okay? So, the first thing that I'm going to be talking about is sunburn, okay? Where do we get sunburn? Everywhere, our skin. Any place that we have skin, we can be burned, okay? Skin is the largest organ of our body. It is the first line of defense. Skin is the barrier to the outside. It keeps us from free from disease. It keeps us free from bacteria. Imagine, just real briefly, if you had no skin. Ew. Every time I think about that, your muscles would be weeping, they would dry out, and probably wouldn't work properly at all. Okay, you would be leaking everywhere. You would have nothing to hold your abdominal contents in, okay? Skin is very important, okay? And on the skin, you have your epidermis, which is what you see here. You have your dermis, which is underneath that, okay? Then you have your subcutaneous, which is the fatty part, okay? So if you get a severe burn, it could definitely go down to the cutaneous part of your skin, which that is not a good thing. And we'll talk more about that in a minute. So, our first degree sunburns, the symptoms is sunburns, reddening of the skin, and possibly a slight fever. When we say slight fever, it's like fever to the touch. You might feel a little sluggish. I will say the first thing that you should do, being out in the sun, drink a lot of water. Hydrate, 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 hydrate. You can't drink enough water as long as you don't drink it all at one time. There was a contest in Arizona, one of those radio shows where they had people come down. You can come down, you can win $500. And so here comes people. All you have to do is drink a gallon of water in a very short amount of time, like 5 minutes. So, $500, everybody, all these people were down there. Well, this one lady, she achieved it. She actually drank the water, but she also demised this result of it. So you don't want to overload. You want to take it in moderation, means that if you were to drink, you have cups there, if you were to drink 3 or 4 of those at one time, that would be fine. Okay, what you don't want to do is drink a gallon of water in under 5 minutes. That's not so fine. So, a lot of water, it might produce a slight fever for the first degree burn. For your second degree burns, degree burns makes reddening and water blisters, okay? And those are the little fluid bumps that you see up on your skin. Those are called water blisters, okay? And your third degree burn, sunburns produce damage to the lower cells and the release of fluid. So the lower cells are the cutaneous portion of your skin. And I did a little diagram. I don't know, you can't really see it very well, but the top layer, that's where your hairs are, and that's your dermis. And then right up underneath there is your dermis layer, and then your subcutaneous tissue. If you end up with a burn in your subcutaneous that it penetrates that far, you consider it a third degree burn. And at that point, you want to seek professional help. Okay, the above results in eruptions and skin breaks through which bacteria and infection can enter. This may take 1 to 24 hours after sun exposure and usually reaches its peak within 2 to 3 days. You see, when we say peak, that means that you've been exposed to the sun today. By Tuesday or Wednesday, you will start to notice peeling, or that it's still red, real kind of angry red, kind of slightly painful to the touch, that sort of thing. If by then you start noticing huge blisters, that's not a good burn, and you need to seek professional help. okay? But by the third day, you should start noticing at that point, it'll start going the other way, meaning that your body has started to heal, okay? And we have some remedies that we can use to help that process. So the causes, there has been excessive exposure to ultraviolet rays, the sun, and that's even on a cloudy day. First burns the surface skin and later the lower layers or the lower cell layers of the skin. Now, sun can also age the skin, okay? Because of the fact that your skin is working overtime. When you're exposing it to the sun rays, it is working overtime to try and do what it's supposed to do. Skin is our temperature regulator. It helps to keep our core temperature at a steady degrees. And if we're outside baking in the sun, the skin is like working overtime trying to keep the organs and the tissues inside the body, trying to keep it at a regular temperature. Now, many drugstores, they sell remedies for sunburns, and those remedies has numbing agents, okay? So when you get the store-bought, in which every time we get sick, every time we get an owie, that sort of thing, what's the first thing we do? Run to the drugstore. And when we get to the drugstore, we start buying all of this over-the-counter medicine. And because after all, the drug companies, they make this stuff. It couldn't be bad for you. Or is it? So, while they do have a lot of products on the market to help with the sunburns, it's really what you're getting is like a lidocaine, gel, cream, oil, and it has a numbing agent in it. That's all that it's doing. It's just numbing it for a short amount of time, okay? So you want to be very careful, hence the natural remedies, which cost far less. It takes more time for the natural remedies than it does for the store-bought remedies. But in the long runs, the natural remedies are well worth it, whereas the store-bought remedies are short-lived. Okay, so that's just something to remember. So it has numbing agents for the pain, but they do very little to support the body's own healing system. Natural methods are better. Now, fair-skinned people will burn faster than darker-skinned people. However, there is one thing that all shades of people have in common, and that is skin. It's all the same. It does the same function, no matter what background that you come from. So if you are a fairer skinned person, you want to be extra careful out in the sun. If you are a darker skinned person, you still want to be extra careful, but you can possibly stay out in the sun a little bit longer. The worst time to be in the sun is from 10 in the morning till 2 in the afternoon. Now, with all of the different warming, global warming supposedly, all of the different shifts in environment, the shifts of the poles of the earth, whatever those are, that can change, especially like here in California. It seems like it gets the hottest around 3 o'clock. So that kind of shoots that, 10 to 2 right out the window. I would say protect yourself from 10 to 4. Those are the extreme times where the sun is most intense, okay? And please feel free, any point of this that you have a question, please feel free, just stop me and I will be more than happy to try and to respond to your question, okay? So, turning my stuff over. Also, reflections from the water can intensify the heat of the sun. Reflections from snow, metal, sheeting on a building or what have you. See how some people will sit in a chair and they have this big thing in front of them and it's a reflective deal. The sun will hit the reflector and it pushes up onto the face or the skin, and it's supposed to intensify, get you darker quicker. Okay, and actually the only thing that you're doing, you're not getting dark quicker, you are damaging your skin faster. Okay, that's pretty much what you're doing. White and aluminum painting surfaces, that can also intensify the effect. So with all of this, we also have to remember, even if it's a cloudy day, there is still UV rays out there in the atmosphere. So you always want to make sure that you have some sort of skin protection on you, some sort of sunscreen with SPF, okay? At least SPF of at least higher than 12 or 15. Of course, they have it all the way up to like 50, and I'll talk more about that in a minute. So how do we prevent ourselves? How do we protect ourselves from the sun? And I will say this, the sun is not the same in our environment as it was back in the 50s or the 60s. A lot of different changes because our environment, our communities have changed, industry has changed. And so we are creating more and more and more pollutants. The more people that we get onto the planet, the more we have to change in the industry in order to keep up with for demand. You go to China, you see people with masks on. All of our products, a lot of our bowls and things like that, they're all made in China. And so the people are getting the effects of industry manufacturing. So they have the mask on to keep from breathing in all of the different harmful agents that are in the air as a result. And it's not just China. Any place, India, Africa, any place that they have mass production, you are going to find harmful bacteria and various different things in the environment to potentially harm us. So, how do we prevent? Well, that's really easy. Don't expose yourself to the sun. But that's not reality, right? Okay, you still have to go outside. So, but what you want to do is try not to expose yourself between those hours, as I said, as they are the highest concentrate of ultraviolet rays. And a quick other disclaimer is that I get a lot of my information, the majority of my information, from the Natural Remedies Encyclopedia. Okay, I want to put that out there. Vance H. Farrell and Harold M. Cherney, MD. These are individuals, if you ever get a chance to look over the book, to find it, do so. There are so many different types of remedies that are in this book that will help you in your everyday life. It even helped me follow a young woman who had no prenatal care. She had no insurance, and she did not have the means to seek a doctor. So based on the information that was in that book, I helped her throughout her pregnancy, and she delivered a beautiful, healthy baby boy. I was so excited about that. It was a lot of work, though. It's a lot of work bringing us into this world. An awful lot of work. So, yes, ma'am.
I'm sorry, did you deliver the baby?
No. I did not deliver the baby. We ended up going to the hospital because, you know, they can't refuse you. If you show up at the hospital, and they could not refuse her because the baby was like, he was ready to come. And so we were able to go in, and I was there with her, and I did, through prayer, a lot of massage, a lot of encouragement, a lot of physical support. You know, pregnant women tend to want to lean on you. So it was a lot of physical, strength.
You're like a coach then.
I was her doula.
Okay.
Yes.
Right.
And so it was a really nice experience, and I'm still contemplating, maybe I'll get into that, but anyway. So, moving right along. So for our 3rd-degree burns, you want to, which is very serious, and that's in your syllabi there, seek the counsel of a healthcare professional immediately, okay? Water applications will help, and it keeps the muscles flexible, and drink plenty of fluids. Now, when I say that it keeps the muscles flexible, a strong sunburn can cause the underlying muscles to contract. And when that happens, it can stay fixed into that position. So you want to keep your muscles, if it's in your arms, try to keep your arms moving them, okay? Because you don't want your muscles to contract up until you can get to a healthcare professional. As I said, water applications will help, and what I mean by that is all you have to do is just take a towel, submerge it in some cold water, wring it slightly, it can still be a little bit sloppy, and then put it directly onto the burned area and get to seeking medical professional help. The reason for that, as I said before, third-degree burns can be very serious because what's happening is the underlying cutaneous tissue is not being able to do its job. And if it's not being able to do its job by secreting the fluids that your body needs for your natural organs to stay healthy, then you can be in some serious trouble really fast. So definitely seek that. But for now, for our first and second degree burns, we can treat those ourselves. One thing we have to remember though, on a second degree burn, watch it very closely. Because what we think, oh, well, yeah, it's peeling, it'll be fine. And then all of a sudden you start noticing rawness happening, meaning that the skin is sloughing off to expose the underlying flesh. That's a serious burn. You need to seek some professional help. Stop treating it with your natural stuff. But if you just notice that you have a first degree burn or a slight second, put yourself in water, cool water on a burn, or you can lie in a cool bath, okay? It's like you start to get in. But if you're burning, you'll want to just get in there and just kind of float around a little bit in that bath to help soothe the burn. Another thing you can do is you can place the dry oatmeal in a bag and run cool water through it. And you can save the water, you can throw away. Now here it says throw away the contents of the bag and use the water in a compress. I would say after you run the water through the cloth, okay, and you have to do it a few times, you can take the oatmeal and you can use it for cookies. You could also take the oatmeal and you can heat it, put some raisins or something like that on it, and you can have it for a meal. You don't have to waste it, okay? So when it says, and at this point I'm going to get in to start doing the remedies as I go along here. When it says to put it in a bag, I have some cheesecloth here. You can use cheesecloth, you can use muslin, or you can just use a linen towel. And you don't need much of it. So, well, our scissors here, these are those scissors that everybody has used. And you have to find the right little edge to, to start cutting on them. Otherwise, in surgery, we call them gnawers because we go to cut some suture and it just, you know, it doesn't work. So we want a piece of cloth about this big, and we can open it up, and then we take, not a lot, I would say about maybe half of this, and depending on the size of your burn, okay, you want to just wrap it up like this. And then the other thing that you can do is you can wrap one of those little twisty ties around it, which I don't have those, but that's okay. Get a bowl, okay, again, based on the size of the burn that you're trying to treat, will determine how much of this that you need. And so you take it here and just run your water through slowly because you want the effects of the oatmeal, the runoff of the oatmeal. And you will see, and I will bring it around and show it to you, you will see the cloudiness in the water. And that's all I'm going to do there. Just kind of squeeze it a little bit, okay? And, as I said, that can be a quick meal for you. I will bring it around and show you the density in just that much time, just those little, and you see the color, it changes to a kind of cloudy look. Oh, I was going to bring it there. You see, it changes to a little bit of a cloudy look, okay? And by the cloudiness, that's the properties from, that's the healing properties of the oatmeal. Now some will say, yeah, but if you rinse all of that off, what about the nutrients in the oatmeal? The nutrients are still in the oatmeal. As a matter of fact, the oatmeal will still provide you the fiber that is necessary. It will still provide you with the various vitamins that you need. So you take that and here we go. And you take your towel, okay? And who would like to have this on their skin? Who's not afraid of the oatmeal? We're not afraid of no oatmeal. I mean, it's not going to give you it's not going to give you the effects. So, and then you just take and you just lay it on like that, and you just leave it on. How does that feel?
Cool.
Kind of cool.
Yeah.
Yeah, and that's all you do, and you turn it. Because you fold it in fours, so then you turn it this way, then you open up and turn it that way. Then, you know what I'm saying? So you always have that a fresh area, and you just leave it on for 10 to 15 minutes at a time, and then you take it off and you re-wring it in the water and do it again and keep repeating. Now, something that you can do is you can take your water from your oatmeal and you can put it in the refrigerator so that it stays cool. So that every time that you rinse the towel again, it'll still be cold. Now, I wouldn't want to drink this, okay? That would not be good. So you can also make, like when you take your bath in cool water, like what we were mentioning here, you can make a couple, 2 or 3 of these, and you can put them in the water. Now, when you do that and you let it sit in the water, I wouldn't eat that. Because at that point, if it's sitting in the water, you know, you could get in the water with it, but to lift them out of there after being in the more warmer water than say what's here, because if you run a bath, you're not going to run it just cold. You're going to put a little bit of warm in it in order to make it tippet. And that will start to change the properties of the oatmeal. Okay, so in a bath, these are fine. It will take 5 or 6 of them in order to give you what you need in a bathtub. Okay, now, don't ever, ever, ever do this without securing your little baggie, because you don't want oatmeal running down your drain. Next thing you know, you got a clogged drain. Then after the clogged drain, then you got to get the plumber. You see where I'm going with that? Okay. So, moving right along, are there any questions about that one? Okay. So, as I said, it says throw away the watery contents, but you don't need to do that. Another thing that we can do, on your handout, if you notice, there was a little typo. It's not also vera, it's aloe vera. Okay, I don't know if you guys caught that. Okay, anyway, aloe vera. So this is aloe vera plant, and how in the wide world, though, are we going to get enough aloe vera to put on, say we've got a sunburn all across our back, okay? How are we going to be able to get enough aloe vera out of that in order to put all on our back? You know, well, we can take, and I'm going to cut your, okay. You can take it, always cut it on the diagonal, okay? And you can start squeezing. You squeeze a bit, rub it. Squeeze a bit more, rub it. When you have no more to squeeze there, then cut it again. okay? You just keep doing that all the way down until you're at the end. And by that time, this much right here will probably cover my shoulder area. Just that much, okay? And for anybody who doesn't know what aloe vera feels like, we'll pass it around. Oh, you, okay, you can pass it around and squeeze a little bit, okay? Aloe vera will help to soothe the burn, especially after you do the aloe vera and then you sit in front of a fan. It is amazing. It works wonders. Okay. The other thing that you can use is tea tree oil, which you can take your tea tree oil and you can put it in some other oils, such as like a carrier oil, like a coconut oil or something like that, a few drops in. What the tea tree oil will help do, it helps to keep any sort of bacteria out of the burned area, okay? It's wonderful for that. It will relieve some of the pain that is involved with the sunburn. But to me, the most important is that it helps to keep the bacteria out. You know, it helps to keep the bacteria. So very good for that. Also, another thing is frankincense. Okay, frankincense is really good for burns. It helps to relieve pain. It also helps to relieve the stress that is associated with the having to have the burn to begin with, because it's not just a physical thing. It also goes into a mental or an emotional thing. You're trying to put something on, you're late for work, and you know, you've got this burn. So the frankincense is very good at helping to alleviate the pain that's involved with the sunburn. Now, if you get essential oils, you have to make sure they say pure oils. Some oils, like this one here, is mixed with a jojoba oil, okay? And when it is mixed, it's not saying that it's not pure. It's just that there is a carrier oil already there. Could you open up that door, please? And so look for that. Don't get anything that says fragrance oil, because that's not essential oil. It's not, it's just an essence. That's all it is, it's just essence. So you want to make sure that you're, watch out for that. Now we have clay poultices, which is just mud. You go outside, you run your hose for a bit, and you get mud. And you can put that on a sunburn. And a lot of people are like, you did it as kids, you just didn't know that's what you were doing, okay? So anyway, I am my apologies here real quick. It is very warm up here, and I am a mature lady, so my apologies there that I have definitely, it is very warm here. Imagine that, when I first got here to California, it was cold all the time, and now it's like it's heating up. So anyway, so yes, the clay it's just mud. So you don't want to get mud with worms in it. That might be a deterrent, okay? Witch hazel. Oh, the lovely witch hazel. Love this stuff.
That's the stuff you saw.
The witch hazel is good. You can take it, like if you don't have a really big burn, or especially if it's on your face, what you can do is you can get always pure, natural cotton. You don't want to get anyway, you don't want to get cosmetic puffs. You always want 100% pure cotton if you're going to put it on your face, anything on your body. The problem with the cosmetic puffs is that it has fibers, different types of synthetic fibers in it, which can cause damage to your skin over a period of time. So you always want to get the pure cotton. It doesn't have to be these rounds. It can be the cotton balls, but just make sure that it's that it says that. Now, for your witch hazel, you can buy like the muckety muck kind that's huge in out the pocket. It's going to cost you about $4.59 for this. Very good. Or you can buy the lesser, the store brand, same thing, okay? And to prove that, on the back of the bottles, here it says all natural witch hazel, 100%, and then underneath it says containing natural grain alcohol, 14%. When we go here, it just says witch hazel, let's see, inactive ingredient is alcohol by 14% volume. $1.59, $4.59. This is a pretty bottle though, I do have to admit. So, this one is not open. So what I'm going to do is I'm going to take this and I'm going to come around and give everyone a little taste of some witch hazel. And you can take and you can rub it on your skin, on the back of your hand, and you can rub it on the back of your hand and then wave your hand around and see how that feels. You don't have to rub it hard, okay? Just rub it on the back of your hand and then wave your hand and see how that feels, okay? It should be cooling. Do you feel a cooling? You can put some on your neck there. Oh, I gotta get one more.
Now go run around. See if it feels cool.
Okay, you just kind of wave it around a little bit, and do you feel a cooling? Yeah. So you can use this, okay, and you can also use it in front of a fan, okay, and it will you will get the cooling effect from the sunburn. Okay, so you can use witch hazel, which is a very good astringent. I use it every day. When I wash my face, after I wash my face, then I take and I use with the cotton, with the little puff here, and I take off excess dirt. And it's amazing because you think you're washing with your facial bar, never soap, but your facial bar, and then you think it's all clean, okay? And then you use that and it's like, whoa, wait a minute, I still have dirt on my face. But I keep rubbing until it's gone. So that's a really good thing, witch hazel. Plain yogurt, yes ma'am.
Is this for cleaning?
I do for freshening. Because the proper steps to skin care is to cleanse, freshen, moisturize, protect, and exfoliate.
So can this be like a toning?
Yes, yes, that's exactly what it is. It's a freshener or toner. Yes.
If you have a mean rosacea, will it affect?
It shouldn't, but again, you use the test area here. However, if you're going to use it on your face, I would go right up underneath here because this is where the skin is sensitive. So if you start to notice any sort of reddening, any sort of issue there, then you probably don't want to use it. Most likely, witch hazel, I have never seen anyone have a problem with witch hazel. There's always a first though. You could be the first on your block, that sort of thing. Plain yogurt, you can do. I don't advocate dairy myself, but you can use it. That's all you got is some plain yogurt, and you're burning. Get it on there. Not the yogurt that has the blueberries or the chocolates or the additive. I'm talking plain, yucky, plain yogurt, sour, bitter, that sort of thing. It's soothing, okay? The same for sour cream, it's soothing. The reason why you don't want the extra stuff that's added into the yogurt is that it's sugar. And I have 76 reasons why not to use sugar. We should not be consuming sugar into our bodies, but that's another seminar, okay? Cornstarch. You can take your cornstarch, you can take a few teaspoons, and you can make a cornstarch paste. I'm just going to use that one heaping teaspoon rather than in and out, in and out. And how you do this is that you add a spoonful of water at a time, because the starch can go runny really fast. And you have to just add a few and then stir it around, see how your consistency is, and I think that that's going to be pretty much it. If it gets too runny, just add a little bit more cornstarch. A little bit of cornstarch, a little bit of water, or a little bit of water, a little bit of cornstarch. However it is that you need to do it in order to get a paste. Okay, now this is kind of a little bit on the runny side, but it could possibly work. And then you just take it with a butter knife and you put it onto the burn. And it is cool to the touch. You can feel how some people use this, and you can dip your finger in it and put it on your skin there. It's you know, just for the consistency of it. It's still a little bit on the runny side, but yeah, just rub it on the back of your hand. And it washes off really easy. Yep, just right there and rub it on the back of your hand. And you can wave your hand around a little, and you can kind of feel how it will possibly cool the skin. Okay, so just regular old cornstarch. This happens to be organic cornstarch and non-GMO. Okay, so a cornstarch paste. And I'm sorry, I should have put the baking soda in there. My bad. Just a little bit of baking soda. Okay. My bad. The baking soda mixed with the cornstarch, it helps to provide a little bit of antiseptic to your skin. Okay, so you can see this is getting kind of hard to mix. Okay, so basically the same thing, just that I forgot the, you know. Yeah, do you see how that? It's thicker. Yeah, it is thicker, and it's sort of like kind of pulls apart kind of easy. Now you can also use your cotton brown that you have if you want to take this off of your skin. Okay, well, you can use a little bit there. Okay. Okay. Yeah, and this will, and you may think, oh, this is not going to help. It will help. It definitely will help. Okay, so the other thing that you can use is an ice bag. 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off. I would suggest that you put the ice in some sort of a muslin cloth as opposed to terry, because having the terry cloth on your skin, it may rub and irritate. So I would suggest that you use like a linen cloth as opposed to a terry cloth. Okay, and we know the difference, right? Where did my terry cloth? the green
Oh, I
one?
put it on the sink, it was dripping.
Oh, okay. Well, we know what terry cloths are. Okay, so you want to use something that's kind of smooth, that doesn't have a lot of little fibers on it. Okay? Cucumber, raw eggplant, plantain. Those are all various different things that you can use on the skin. And I happen to have some cucumber. The cucumber is just absolutely, I love the cucumber. I have a spoon here, yeah. Now, for the cucumber, you can also use this. You can kind of kill two birds with one stone. I usually don't like to do that. But anyway, you can potentially kill two birds with one stone. You can take your cucumber, you can chop it up, and there's no rhyme or reason, you just chop it up, okay? And let's see if I can get how about some paper towels, the heavier one, so that everybody can have a paper towel. And then you're going to get a paper towel, and I'm going to come around and I'm going to put this on your skin. And what I did was I chopped this up. I didn't add anything to it but a little bit of water to cover, just barely cover the top of the cucumber, and that's it. And I put it in the freezer. Now you can put it in the refrigerator. I put it in the freezer just to help speed the process along a little bit there. Okay, are we ready? So what I'm going to do is I'm going to put this on your skin, and you're going to feel the cooling effect of the cucumber. To me, if you have a sunburn, this is the best. I said it was also a double thing. Okay, you can also, while you're cooling your sunburn, you can close your eyes and you can put some on your face, and you can get the beauty properties, okay, of the cucumber. Okay, so you tell me where you want it. I'm going to put this directly on your skin, and you're going to take the paper towel, and then you're going to cover it, fold the paper towel lengthwise, like that, okay? Now, when I put this on, then you're going to immediately strap the paper towel over it, okay? No, take the paper towel off your skin, off. Okay, show me where you want it, okay? So I'm going to put okay, and then put the paper towel over it and hold it. Okay, you see how that's working there? Okay, underneath there, and I'll put this on here, and there you go, right? Put it over the bowl. Put it over the bowl, yeah. Okay, and then just put that over that. Okay, put it over the bowl.
It's real cool.
Okay, and just put it, and just hold it.
Too cold.
Just a little bit.
Okay.
I've got some sunburn here.
Oh, really? Oh, you want to do it there? Okay, so let me put it on the paper towel. Let me put it on the paper towel. Okay.
Thank you.
All right. Now, as I say, you can also use this for facial. Put your arm over the bowl.
Well, I got a bad spot up there.
Is that okay, let me put it on the paper towel.
Just go dry.
Everything has to be
Really?
just right.
Okay, let's put it on the paper towel and then put that on. Okay.
Is it working?
Yeah.
Good.
Okay.
So you got windburn from riding?
Yes.
Well,
So,
I did a little yard work.
Okay.
what do we think about the cucumber? Now, as I said, cucumber, it's got cooling, healing properties. The healing properties, if you notice, I did it with the skin still on it. The healing properties, you have vitamins and minerals within the cucumber that is good for the skin. It helps to hydrate the skin. It helps to hydrate the body. Your skin will start drinking in the moisture from the cucumber. And it thus is replenishing the body from the from the moisture that is lost because of the sunburn. Okay? Any questions? Yes.
Does it work on, I mean, would it work on like actual burns?
Yes, yes. Sunburns, burns, like, I'm glad you asked that question because I will say here, do not use any products containing alcohol. We say, yeah, but there's alcohol in here. The astringent, the witch hazel, neutralizes what alcohol is in this, and that's why this is safe to use. So you don't use anything containing alcohol, mineral oil, butter. When we get burned in the kitchen, what's the first thing we want to do? Grab some butter and put the butter on. What is the butter doing? What's that?
The butter.
The butter is cooking it.
Yeah.
It's going to cook it. Because what happens when you heat oil? When you start heating oil up, it starts cooking whatever it's on. Don't put butter on a burn because your skin is hot. And you put the butter on there, you're cooking your burn. And you're wondering, well, it's just not getting any better. And it usually will blister and bubble up.
You eat this?
Okay, so you don't want to put that on there. Mineral oil, colorings of any kind, or wax. Who would put a wax on a burn? Now, if your legs are burned, this is very important. If your legs are burned, what you want to do is you want to elevate your legs above your heart and do whatever treatment that you need to do. Okay, your legs, the muscles, you can start cramping up. Okay. Once they start spasming, before you know it, when I remember I talked about the contracting of the muscles, that is something that could very well happen. So you want to make sure that you elevate your legs above your heart in order to take care of the burns that is incurred on your legs. Okay, very important. And the burned area, it is delicate. Okay, we have to remember that it is delicate. And it takes generally 3 to 6 months after a sunburn for your body to heal itself. For it to all of a sudden you're doing well again. My advice or my suggestion, try to limit your exposure in the sun. If you are going to suntan, do it in small increments. Meaning that today maybe get 10 minutes tops. Then come back again tomorrow, 10 minutes tops. And keep gradually let your skin get the tan that you are wanting. Don't get out there and try to get it all at one time. It just doesn't work, okay? And I will say I do have a note here. Where's my other note? Okay. The sunscreen. I found some vegan sunscreen, believe it or not. And you will never guess where I found this at. I got this from the grocery outlet.
Wow.
The grocery outlet. Very inexpensive. I think it was $2.59. And it is SPF, a broad spectrum of 20. And some people will say, what is SPF? Okay, does anybody know what SPF stands for? I don't know if I have a prize. I don't know if I have a prize for that. Oh, this is grass cutting day, huh?
I just know it's good. That's all.
Okay, SPF stands for Sun Protection Factor. Who knew that? I had to look it up. So yes, it stands for Sun Protection Factor. Apply a sunscreen about 30 minutes before going outside. Okay, you want SPF of 15 or higher. And they are making skincare products like moisturizers. They are making them now with the SPF in them. Okay. And it's relative measure of how long the sunscreen will protect you from ultraviolet B rays, okay? The chief cause of reddening and sunburn UVB rays tend to damage the epidermis skin, outer layers, where the most common and least dangerous, okay? Some people will say, but what about tanning beds? They are using, instead of, instead of the UVB rays, they're using UVA. And those are longer wavelengths, and they penetrate deeper into the skin. So they will go beyond the epidermis, okay? And you don't want that. Be very careful. Just because it's a tanning bed, it's not the sun. Tanning bed can actually be more harmful than the actual sun itself, okay? And the thing is that it's over a long period of time. You can end up, I made some notes here, about the UVA rays. They are long enough to reach the skin's dermal layer, damaging collagen and elastic tissue. So your people that you see that get that strange leathery look, they have some serious problems, and they're going to have them throughout the rest of their life. That layer is also where the cells that stimulate skin darkening are found. That's why the UVA rays are considered the dominant tanning rays, which are also used, of course, in the tanning beds. Over a long period of time, these rays get into the DNA, okay, and it damages. The skin darkens in an imperfect attempt to prevent I lost my note. Oh, there it is. To prevent the further injury, which can lead to the cell mutations that trigger skin cancer. So you want to be careful when you are dealing with tanning beds. I say stay away from them. I just know that in my mind or my heart of hearts, it's just not a good thing, okay? So, anytime that you have skin, you are going to have potential of a wound. A wound is considered a break in skin. If you have a sunburn, that's a break in the regular turgor of the skin, okay? Thus, it's a wound. So what do we do when we have dry, chafing, itchy skin, okay? We try our best to, we put all of these store-bought lotions on, not a good thing. In God's pantry, in his medicine cabinet and his refrigerator has everything that we need to keep our skin happy and healthy, okay? When we have overly dry skin, it is usually a loss of water as well as a loss of oil. Some people, when their skin gets really dry like that, they'll start taking vitamin A. That can be the reason why your skin is so dry. If you're taking large amounts of vitamin A, it could be potential that you are overdosing and you should seek medical attention. It's not good to take too much vitamin A, okay? So you want to be careful. Through natural remedies and diet, you can keep your skin looking healthy and fresh. Vegetables, fruits, grains, seeds, legumes, and nuts. High sulfur foods such as garlic, asparagus. Those are very good for the dry skin as well. Some of our ingredients that we have used here, aloe vera, essential oils, oatmeal. The other thing that you can do for really overly dry skin, and by getting a really bad sunburn, what's going to happen? Your skin is going to dry out. So you can take a nice bath, tepid bath, with vinegar. I don't say pour the whole bottle, of maybe a quarter cup of vinegar into a regular bath, not real hot. That's another thing. We love that hot water, don't we? That hot water is killing our skin. We need something a little bit more on the cooler side, okay? Not cold water, but cooler. Something that we can talk about later on when we get into the hydro and all of that. But you want to, just a regular bath, you want to put about a quarter cup of vinegar into the bath, maybe an eighth of a cup really. You don't want to smell like you've gotten out, jumped into a salad. You just don't want to smell like that. So vinegar, vegetable oil. Vegetable oil, as long as it is 100% pure vegetable, that is not a blended oil, okay? olive oil. And this is an example of olive oil. If you buy olive oil, you want to go cold press. If you can't find cold press, you want to make sure though that your bottle is dark, because direct light, it can be this type of light indoors, direct light can cause your oil to go rancid, okay? And you can use this directly out of the bottle, okay?